Welcome to this special edition of FDA Tobacco Compliance Webinars. Information for retailers and small businesses, sponsored by the U.S. Food and Drug Administration and its Center for Tobacco Products. I'm David Racine. Thanks for joining us today. FDA recently issued a final rule extending its authority to regulate additional tobacco products. And this webinar is one of the first in a new series of webinars designed to assist regulated tobacco industry. And joining me to provide an overview of the final rule is Jerry Voss, Supervisory Regulatory Counsel in the Office of Regulations at the Center for Tobacco Products in FDA. Now, we won't be taking any live questions during today's presentation, but you can send us your questions by email at askctp@fda.hhs.gov. And at the end of the program, we'll provide you with information on how you can get answers to your questions. We want to encourage all of our viewers to check our website, www.fda.gov/tobacco products, for some additional upcoming webinars related to the deeming regulation. We'll be posting those as soon as we get them scheduled. Some of the webinars we have planned include an overview of the new requirements for tobacco retailers, a webinar focusing on FDA's Compliance Check Inspection Program for tobacco retailers, a webinar for vape shops, and many others. Please check back often or sign up for the Center's This Week in CTP email service. Now, let me turn the program over to Jerry.
Thanks, David. Hello, everyone. Today I'm going to discuss FDA's final rule in the Federal Register entitled Deeming Tobacco Products to be Subject to the Food, Drug, and Cosmetic Act as amended by the Family Smoking Prevention and Tobacco Control Act, regulations on the sale and distribution of tobacco products, and required warning statements for tobacco products. Today, I will refer to this final rule as the Deeming Rule. The webinar I will present today provides an overview of the Deeming Rule. For a full explanation of the rule, please read the rulemaking document available in the Federal Register and on our website at fda.gov/tobacco. FDA is taking this action to reduce the death and disease from tobacco products. This final Deeming Rule affords FDA additional tools to reduce the number of illnesses and premature deaths associated with tobacco product use. During this webinar, I will be discussing FDA's tobacco product authorities. I will then provide a summary of the proposed rule. I will then discuss deemed products now subject to tobacco authorities. I will explain the deeming provision and the additional restrictions for covered tobacco products, including the health warnings. I will then discuss some key issues FDA considered when considering the comments and writing the final rule. Lastly, I will discuss the effective dates of the rule and compliance periods for certain provisions, as well as additional documents that were published with the Deeming Rule. Let's begin with FDA's Tobacco Product Authority. The Tobacco Control Act gave FDA immediate authority over cigarettes, cigarette tobacco, roll your own tobacco, or RYO, and smokeless tobacco. Section 901 of the Tobacco Control Act also permits FDA to issue regulations deeming other products that meet the definition of tobacco product to be subject to FDA's authority. These products include, but are not limited to, cigars, electronic nicotine delivery systems, or ENDS, including electronic cigarettes, pipe tobacco, and water pipe tobacco. And Section 906D allows FDA to propose restrictions on the sale and distribution of tobacco products if such regulation would be appropriate for the protection of public health. I will now provide a summary of the proposed rule. There were two parts to the proposed rule. The first part was the deeming provision, the provision that subjects additional tobacco products to FDA's tobacco product authorities. This provision was issued pursuant to Section 901. Although the law does not set forth any particular public health standard for FDA to deem tobacco products, the preamble described significant benefits that would be associated with deeming these products. The additional restrictions were proposed pursuant to Section 906D of the Food, Drug, and Cosmetic Act. When issuing regulations under this provision, the law requires that we consider the risks and benefits to the population as a whole, taking into account, 1, the increased or decreased likelihood that existing users of tobacco products will stop using the products, and 2, the increased or decreased likelihood that those who do not use tobacco products will start using the products. FDA received over 135,000 comments on the proposed rule from many different stakeholders. The comments were carefully considered when finalizing the rule. The final rule extends FDA's authority to all products that meet the statutory definition of a tobacco product, except accessories of those products. A tobacco product is defined as any product made or derived from tobacco that is intended for human consumption, including any component, part, or accessory thereof that is not a drug, device, or combination product. However, the rule exempts from the scope of deeming any accessories of the newly deemed products. To be clear, components and parts of these products are subject to deeming, but the accessories are not. Components and parts of these products, for example, e-liquids, are within the scope of the rule. As you can see from this slide, deemed products include, but are not limited to, electronic nicotine delivery systems, or ENDS, including e-cigarettes, e-cigars, e-hookah, vape pens, personal vaporizers, and electronic pipes, water pipe or hookah tobacco, cigars, pipe tobacco, dissolvables, and nicotine gels. The industry keeps changing, so the deeming rule also gives FDA the authority over future products meeting the definition of tobacco product. Now, I will further discuss the deeming provision. The deeming portion of the rule will subject products excluding accessories meeting the definition of tobacco product to our existing tobacco product authorities found in the Food, Drug, and Cosmetic Act. Once the deeming rule becomes effective, the provisions in the Food, Drug, and Cosmetic Act and its implementing regulations that generally apply to tobacco products will be extended to and automatically applied to deemed products. Some examples of these automatic provisions are establishment registration. Every person who owns or operates a domestic establishment that manufactures, prepares, compounds, or processes products covered by this final rule is required to register with FDA and provide product listings. Other examples of provisions that automatically apply to newly deemed tobacco products are the adulteration and misbranding provisions. For example, if a product was prepared in insanitary conditions or was contaminated, or if its labeling or advertising is false or misleading, FDA could take action, including enforcement actions if necessary, to address these issues. Some other automatic provisions include the requirement that manufacturers provide ingredient listings and comply with pre-market review requirements. FDA could also issue additional regulations on deemed products, including product standards. For example, FDA could issue a rule related to nicotine yields or regarding constituents, components, or ingredients, provided such product standards are appropriate for the protection of the public health. FDA could also place further restrictions on the advertising and distribution of a product, provided such restrictions are appropriate for the protection of the public health. This rule also imposes additional restrictions for covered tobacco products. First, the rule prohibits the sale of covered tobacco products to individuals under the age of 18. Second, it prohibits the sale of covered tobacco products using electronic or mechanical devices like vending machines, except in facilities where the retailer ensures that individuals under 18 years of age are prohibited from entering at any time. Third, covered tobacco products are required to display certain health warnings. It is important to note that these three restrictions apply to covered tobacco products. FDA defines covered tobacco product as the tobacco products that are deemed under this rule, but excludes any component or part that is not made or derived from tobacco. Please also note that the prohibition on sales to individuals under 18 and the vending machine restrictions explained here already apply and continue to apply to cigarettes, cigarette tobacco, roll-your-own tobacco, and smokeless tobacco. The Deeming Rule now includes the display of health warnings on cigarette tobacco, roll-your-own tobacco, as well as other covered tobacco products. I will now further discuss the health warning requirements. We are requiring 6 health warnings with this rule. The first warning is required for all covered tobacco products, cigarette tobacco and roll-your-own tobacco, and reads, "Warning, this product contains nicotine. Nicotine is an addictive chemical." So this warning is required for cigars and all other newly deemed products, except for components and parts that do not contain nicotine. Requiring health warnings on these products will help consumers better understand and appreciate the addictive properties of these products. However, we recognize that it is possible that someday a tobacco product could be developed that does not contain nicotine. As a result, the final rule includes a self-certification option for tobacco products that do not contain nicotine. For these products, the required statement reads, "This product is made from tobacco." We received comments stating that certain newly deemed products are sold in small packages, which might be too small for the warning. As a result, the final rule includes requirements that tobacco products that are too small to bear the warning may place the warning on a tag permanently affixed to the tobacco product package or on the outer carton or other container or wrapper. The warning must still satisfy the requirements in the rule. For example, the warning must be printed in at least 12-point font size, and in such cases, the carton, outer container, wrapper, or tag will serve as the location of the principal display panels. I will explain principal display panels later in the presentation. In addition to the addictiveness warning, as stated in the proposed rule, cigars are required to display these additional warnings. Warning, cigar smoking can cause cancers of the mouth and throat, even if you do not inhale. Warning, cigar smoking can cause lung cancer and heart disease. Warning, cigars are not a safe alternative to cigarettes. Warning, tobacco smoke increases the risk of lung cancer and heart disease even in non-smokers. In addition, and in response to many comments, FDA is requiring that cigars also display the following reproductive health warning statement. Warning, cigar use while pregnant can harm you and your baby. However, as an optional alternative to the reproductive warning, cigars may bear this health warning statement. Surgeon General's warning: tobacco use increases the risk of infertility, stillbirth, and low birth weight. FDA expects that allowing the optional alternative will benefit cigar manufacturers bound by the FTC consent decrees, as this is a required warning under those decrees. The specifications for the warnings are similar to those for smokeless tobacco products. Therefore, the health warnings are required to be displayed on the two principal display panels of the package and comprise at least 30% of each principal display panel. For advertisements, the health warnings are required to occupy at least 20% of the area of the advertisement. FDA defines principal display panel as the panels of a package that are most likely to be displayed, presented, shown, or examined by the consumer. We are aware that cigars are sometimes sold without product packaging. For this reason, we included a special provision for cigars sold individually and not in product packaging. In these cases, a point of sale sign containing all of the required warning statements is sufficient. We also provide the specifications, including font size and type for these warnings. We note that in these instances, all of the warnings must be placed on a sign that is a minimum of 8.5 by 11 inches, posted on or within 3 inches of each cash register where payments are made, so that the sign is unobstructed and easily read by consumers making their purchase. The effective dates for the health warning requirements are also shown on this slide. These effective dates are for cigars and all other newly deemed products, roll your own, and cigarette tobacco. The effective date for the health warning statement requirements is 24 months after the publication date. After the effective date, manufacturers may no longer manufacture non-compliant products. In addition, beginning 30 days after the effective date, 25 months after the publication date, a manufacturer may not distribute any non-compliant product regardless of the manufacture date. These cigar warning statements must be randomly displayed and distributed on product packaging and rotated quarterly on advertisements in accordance with an approved warning plan. Cigar warning plans must be submitted to FDA by manufacturers, distributors, importers, or certain retailers within 1 year of publication of the final rule. Let's now discuss some key issues that arose from the proposed rule. These issues received many comments, which FDA considered when finalizing the rule. Let's start with premium cigars. The final rule regulates all cigars, including premium cigars. All cigars pose serious negative health risks. We also did not find or receive data or information that provides a basis for FDA to conclude that the patterns of premium cigar use sufficiently reduce the health risks to warrant exclusion from this rule. Researchers estimate that regular cigar smoking was responsible for approximately 9,000 premature deaths, or almost 140,000 years of potential life lost among adults 35 years or older in 2010. FDA remains concerned about the use of all tobacco products, particularly combusted tobacco products like cigars and cigarettes, and remains most concerned about use by youth and young adults given their unique susceptibility to the addictiveness of nicotine. Although youth and young adults tend to smoke mass-market cigar brands, research indicates that they are also using premium cigars. For example, one study revealed that 3.8% of youth aged 12 to 17 and 12.1% of young adults aged 18 to 25 also identified certain premium cigars to be their preferred brands. Individuals in both cohorts reported at least 8 different premium cigar brands among their usual brands, providing evidence that youth and young adults are smoking premium cigars. Many comments requested that FDA define components or parts and accessories. As a result, FDA has included definitions of these terms in the final rule. The final rule defines component or part as any software or assembly of materials intended or reasonably expected to alter or affect the tobacco product's performance, composition, constituents, or characteristics, or to be used with or for the human consumption of a tobacco product. Component or part excludes anything that is an accessory of a tobacco product. Examples of components and parts used with electronic nicotine delivery systems, or ENDS, including e-cigarettes, include e-liquids, atomizers, batteries with or without variable voltage, cartomizers, which are atomizers plus replaceable fluid-filled cartridges, digital display lights to adjust settings, clearomizers, tank systems, flavors used or intended to be used with ENDS, vials that contain e-liquids, and programmable software. Examples of components and parts used with water pipe tobacco include flavor enhancers and the vials or other containers in which they are distributed, hose cooling attachments, water filtration base additives, including those which are flavored water pipe tobacco charcoals and the wrappers or boxes that contain the charcoals, and bowls, valves, hoses, and heads. The final rule does not deem accessories of newly deemed tobacco products. The final rule defines accessory, in part, as any product that is intended or reasonably expected to be used with or for the human consumption of tobacco products, does not contain tobacco, and is not made or derived from tobacco. To meet the definition of accessory, the product must also meet either of the following: is not intended or reasonably expected to affect or alter the performance, composition, constituents, or characteristics of a tobacco product, or is intended or reasonably expected to affect or maintain the performance, composition, constituents, or characteristics of a tobacco product, but solely controls moisture and/or temperature of a stored tobacco product, or solely provides an external heat source to initiate but not maintain combustion of a tobacco product. Examples of accessories are ashtrays, spittoons, hookah tongs, cigar clips, and stands and pipe pouches. Examples of accessories also include humidors or refrigerators that solely control the moisture and/or temperature of a stored product, as well as conventional matches and lighters that solely provide an external heat source to initiate but not maintain combustion of a tobacco product. Newly deemed products are subject to pre-market review requirements. This means that any tobacco product that was not commercially marketed in the United States as of February 15, 2007, will require some type of marketing authorization from FDA. February 15, 2007 is the grandfather date that is set in the Tobacco Control Act. FDA has determined that the agency lacks the authority to change the grandfather date. There are 3 pathways to market new tobacco products. One is the pre-market tobacco product authorization. Another pathway is the substantial equivalence report. This pathway includes both regular substantial equivalence reports as well as provisional reports for products first marketed after February 15, 2007, but prior to March 22, 2011, and for which an SE report was submitted by March 22, 2011. A third pathway is the exemption from substantial equivalence. This pathway is for certain minor modifications to the additives of a product. I will now explain the substantial equivalence pathways in greater detail. In order to obtain a marketing authorization under the substantial equivalence pathway, the manufacturer must compare its product to a specific predicate product, a product that was commercially marketed as of February 15, 2007, or a product that FDA has previously found to be substantial equivalent. For tobacco products that are on the market as of the effective date, FDA is providing 2 compliance periods for pre-market review requirements. One for submission and receipt of applications, and one for obtaining pre-market authorization. The staggered compliance period for submission and FDA receipt of applications under the 3 pre-market review pathways is as follows. Exemption requests. They are to be submitted and received by FDA within 12 months from the effective date of this final rule. SE reports are to be submitted and received by FDA within 18 months from the effective date of this final rule. PMTAs are to be submitted and received by FDA within 24 months from the effective date of this final rule. Manufacturers that have received a denial or refusal may still have time to submit another application through a different pathway and still be under the compliance policy. For example, if a manufacturer applies for an exemption from substantial equivalence and it is denied, the manufacturer could submit a pre-market tobacco application for the product as long as 24 months has not passed since the effective date of this rule. Unless FDA has issued an order denying or refusing to accept the submission, tobacco products for which timely pre-market submissions have been submitted will be subject to a continued compliance period for up to 12 months after the initial compliance period. For exemption requests, the compliance period closes 24 months from the effective date of this final rule. For SE reports, the compliance period closes 30 months from the effective date of this final rule. For PMTAs, the compliance period closes 36 months from the effective date of this final rule. Another key issue is vape shops. We received comments requesting that we clarify whether vape shops can be considered manufacturers. In the final rule, we clarify that establishments that mix and/or prepare combinations of e-liquids or create or modify aerosolizing apparatus for direct sale to consumers for use in ends are tobacco product manufacturers. The combinations that vape shops mix and/or prepare and any new or modified aerosolizing apparatuses are new tobacco products. Vape shops that are manufacturers will be subject to all of the statutory and regulatory requirements that apply to manufacturers, including the requirements to register their establishments, list their products, and obtain pre-market authorization. Vape shops that sell finished tobacco products and do not mix or prepare combinations of e-liquids or create or modify aerosolizing apparatus for product manufacturers are not considered manufacturers. FDA clarified that as a result of the final rule, distribution of free samples of newly deemed tobacco products is prohibited. However, prospective adult buyers may smell or handle the newly deemed products as long as the product is not actually consumed in whole or in part in the retail facility and the prospective buyer does not leave the facility with a free tobacco product. The final rule provides some targeted relief for small-scale tobacco product manufacturers. Small-scale tobacco product manufacturers are those manufacturers of any regulated tobacco product that employs 150 or fewer full-time equivalent employees and has annual total revenues of $5 million or less. The relief FDA is offering includes providing an additional 6 months for initial ingredient reporting and submission of health information, offered only once, and for the first 30 months following the effective date, granting extensions to small-scale manufacturers for SE reports that need additional time to respond to SE deficiency letters. As with manufacturers generally, these small-scale tobacco manufacturers will also benefit from additional assistance with their marketing applications, including a regulatory health project manager so that they have a single point of contact in CTP's Office of Science for questions about their marketing applications. They will also have available an appeals process for denial of marketing applications. Staff from CTP's Office of Compliance and Enforcement, OCE, will assist such businesses in helping them to identify documents that may be used to establish that their predicate products were on the market on February 15, 2007. Finally, CTP's OCE will assist small businesses in their submission of rotational warning plans for FDA approval, and CTP also has an Office of Small Business to assist such businesses in navigating the regulatory requirements of FDA. Manufacturers may voluntarily submit information showing that they are small-scale tobacco product manufacturers. Interested manufacturers may contact CTP's call center at 1-877-CTP-1373 for questions regarding this compliance policy. Generally, the rule is effective on the date of publication for the final rule plus 90 days. This effective date will apply for the automatic provisions, age restrictions, and prohibition on vending machines. For certain automatic provisions, we are providing longer compliance periods. Interested parties can review the tables in the preamble of the Deeming Rule to determine what provisions have longer compliance periods. Lastly, we wanted to note that there are several documents and rules that were published the same day as the Deeming Rule and included in the same issue of the Federal Register. These documents are the Draft Guidance on Pre-Market Tobacco Application, PMTA, submissions for Electronic Nicotine Delivery Systems, or ENDS, the Final Guidance on the Use of Tobacco Product Master Files, and the Final Rule establishing user fees for pipe tobacco and cigars. In addition, the FDA is also announcing its intention to issue a separate proposed rule that would extend the existing flavor ban on cigarettes to cover all cigars with characterizing flavors, including premium cigars, little cigars, and cigarillos. The agency also plans to issue additional rules in the future that address nicotine exposure warnings and child-resistant packaging for e-liquids. That concludes my presentation. David?
Thanks, Jerry. FDA will be holding 2 live question and answer webinars about the deeming regulation in the near future. Now, the first question and answer webinar will be for tobacco retailers. We'll be scheduling and posting the date of that webinar on our website, which is www.fda.gov/tobacco products. If you're a tobacco retailer, please go ahead and send us your questions now via email to askctp@fda.hhs.gov. On the date of the live webinar, we'll start the program with answering many of the questions that you send in for us. I hope you'll be able to participate. I'd like to thank all of you for your participation in today's broadcast, which was brought to you by the Center for Tobacco Products, protecting our kids and the nation's health from tobacco.